Thank you very much. I'm very pleased and excited that this group of, I'm assuming mostly researchers, are interested to learn about the concept of One Health. This is a concept that I've been quite passionate about for about 10 years now. So Jack also just gave some really nice overarching comments. So thank you very much for that, Jack. I apologize, I might be looking away from you because I have a second screen here. This One Health concept is not new. It's a very ancient concept. We're just really kind of resurrecting it. It is, however, a new professional imperative for all of us working really in most any profession. You can realize that we really need each other. So I will just remind us some of the comments that kind of underline this whole One Health concept is that nature and biodiversity are critical not just for their own sake, but for our human health also. There is much research to document that biodiversity is incredibly important to maintain our health and safety also. So John Muir said that when one tugs on a single thread or a single thing in nature, he finds it attached to everything else, including our health. Unfortunately, we as humans tend to think that planet Earth's the center of the universe and we're the most important species, and really we forget that we're just part of an ecological continuum. And that feeds into our health, and we won't get a chance to talk about it much in detail today, but it does really play a significant role in our health. And we as individual researchers looking at this amino acid and this strand of DNA need to be able to remember that at all times, and then seek the opportunities to collaborate with those in other professions that might can contribute to what we're doing. This planet is a very living organism, and we need to treat it with respect, not only for its health and the health of all living creatures, but ours also. So in my mind, the One Health movement started probably in the late 90s, and it came out of the ecology sector. Some of the ecologists started saying, whoa, look at all these diseases that people are getting from animals, and the veterinary sector picked it up, and it took a little while for the human sector to pick it up. That kind of started in the early 2000s, and with all these diseases, some of them Jack mentioned, starting with avian influenza and SARS in 2003 and 2004, and even earlier than that, back in the 80s, when many people don't realize that HIV/AIDS started as a zoonotic disease. So this has been quite a track record through Nipah and Zika and Ebola. And when I made this slide, we were still calling it novel or N coronavirus. So we're really getting some wake-up calls now. And what I'd really like to help everybody understand is that, yes, we started this conversation around zoonotic diseases, but over the past 15 years or so, we've realized that there are many, many arenas that are begging for this cross-professional, trans-professional, interprofessional, deliberate collaborations across all our sectors. So anything from a couple of these we'll touch on animals as sentinels and zoonotic diseases, but also animal welfare and plant and soil health and non-communicable diseases and disaster preparedness. And I have a whole hour's lecture that we could go into some of these with teaching examples. The point is that the collaborations that we need to really address these issues, some of the ones like Jack was suggesting, they're not just magically going to happen in our current systems. Our current systems are what have driven us into our silos. They're going to start with relationships, kind of like what we're forming here today. And those relationships aren't magically going to happen either in our current systems. We're going to have to deliberately create opportunities for us to come together and share information across professions. So that's kind of my take-home message. What we're living today, the One Health community has been warning and teaching about for over 15 years. And this is an incredibly painful and poignant moment to those of us in the One Health space. We have watched this pandemic really decimate our economies and families. It's, for all these numbers that we're seeing of people, of deaths, those are families, those are people, those are lives that are lost. And it's really unfathomable what we're going through now. And what we probably prevented had we been looking down the road and had some collaborations and regular place ahead of time. I'd just like to mention that one of the interesting I've been able to be involved in during this pandemic is to really queue up popular media op-eds and commentaries. And I'm getting a message. I hope my internet's not going to wig out on me here. There's lots and lots of information coming out of the scientific community, scientific publications. But to me, what's important also is what the public is able to understand. So when I see popular media op-eds and commentaries that are credible and well-backed with science, with scientists being interviewed, and they're mentioning One Health or calling for the One Health movement, I get pretty excited. So we've queued up on this page on the One Health Commission's website almost 200 and still counting popular media op-eds or commentaries about the pandemic that mention or call for One Health by name or by philosophy. So please go and look at that. It's really, the public can get quite an education. Discussions about wet labs and how this came about and whether we should be regulating wildlife trade and some really pretty in-depth societal issues that we need to be dealing with. But for this group, I know that many of you are focused on vector-borne diseases, so I'd like to give you a few examples of just how important One Health collaborations can be. So let's go with a couple of little stories, or at least one. This is a true story about a veterinarian's daughter who was a journalist. If any of you on this conference so far logged in are veterinarians, you might even know Robert Miller. He's an American veterinarian that writes, he's a cartoonist, and he writes a column in veterinary medicine. So this is a story about his daughter who went to South America on a journalist trip. She was going to write a story. And she had a fabulous time. She climbed volcanoes and went way up the Amazon. And 2 weeks after getting home, she had really some odd illness, and she was really sick. She had painful swollen joints and fever and skin lesions and discolored fingernails and shortness of breath. And on radiographs, they found lung lesions, and really most disturbingly on abdominal radiographs and on CT scans, they were seeing granulomatous visceral lesions that they were quite concerned about. So none of the doctors could really put together what they were seeing with her travel history. And to make a long story short, 2 years, 76 specialists, and 10 CT scans later, and no telling how much money, she still only had tentative diagnoses, but the most concerning one was the possibility of gastrointestinal stromal tumors. So they had planned to take her, they were planning to take her to surgery. And her dad about that time was at a veterinary conference and was telling some of his colleagues what was going on with his daughter. And one of them said, oh, she's probably got a parasitic disease. She needs to take some ivermectin. And another said, oh, she's probably got a vector-borne disease. She needs to take some doxycycline. But along the way, they told her dad about Dr. Ed Brightsword at NC State and his vector-borne disease lab. Now, I know many of you probably know Dr. Brightsword. I think he has spoken in this conference before. So I'm not going to dawdle and you're probably going to guess that what they found when they got samples sent to his lab, we talked her doctor into sending samples to his lab. They found Bartonella vinsonii. Now, I'm often speaking to audiences who are not particularly well informed about vector-borne diseases. To finish the story, the surgeon came out, they went ahead to surgery, they got the results about the time she was going to surgery, and her dad was waiting outside the surgical suite or in the waiting room. The surgeon comes out and says, well, we didn't see any signs of cancer. And her dad says, well, I never thought she had cancer. I think she's got Bartonellosis. And the surgeon looks at him and says, I'm a surgeon. I don't know what Bartonellosis is. And so this is not bad on the surgeon. None of us can know everything. But it is a poignant reminder of why we need a way to exchange information across professions. For example, what if her radiologist, early on, reading these radiographs and knowing her travel history, had known that this organism, Bartonella, existed and could cause these kinds of lesions? How much money and how much mental anguish could have been saved from these young, for this young woman had they gotten to this diagnosis much more rapidly? So I usually am talking to people who don't know a lot about these diseases, but I'm going to continue and share these slides because this is, in my mind, a prime example of how powerful collaborations across sectors can be. So you're going to hear from Dr. Mosiani in a few minutes, and Robert and Ed became partners, starting back in 2007 or 2009 or so. But this story in particular, and you may hear this from Robert, I apologize, Robert, if you were going to tell this story, but this often shocks audiences because when Dr. Mosiani became aware of Dr. Brightsworth's work and connected, they decided to do a study, and Dr. Mosiani started sending samples of some of his to Brightsworth's lab. And I know you're all sitting down. These people have been given, that whole list of diseases that Jack mentioned a few minutes ago. These are some of the diagnoses that the people have been given. Some of them came to Robert thinking they had rheumatoid arthritis, or some had been treated for Lyme but hadn't gotten better. So here's the shocker. When they stopped about 2 years into this and analyzed what they had, Robert had sent 296 patients samples to Ed's lab. 62% had antibodies to Bartonella, and 41% they actually detected Bartonella species by EPCR in the blood. So that got everybody's attention, and since then, these gentlemen have been doing a fabulous partnership. It continues today. They've done webinars. They've been interviewed on the People's Pharmacy on National Public Radio in the U.S. and on many, many other things. So this particular partnership has been very powerful. I've been meeting some of the people that have been touched by their work. This is a woman that I work with now. She's a teacher who has become very passionate about One Health, educating about One Health and vector-borne diseases because her son got sick with Bartonella and went from an athletic 11-year-old to a wheelchair to a hospital bed. He's now doing much better with the appropriate therapy for Bartonella. He's actually back on his feet and running again. But it took 5 years, and it took 2.5 years for her to even find her way to this collaborative partnership of these doctors. So she's now extremely passionate about teaching children about vector-borne diseases and One Health and how to protect themselves. And this is just an example to me of these powerful, powerful collaborations. As you guys all probably know, Bartonella can manifest in many, many systems. One of the things that I think needs to really be focused on, and I hope you guys can help with this, is that the veterinary world and animal health workers are especially at high risk for being exposed to especially Bartonella and many of these vector-borne diseases. And one of the interesting stories to me is that these red dots in this panel here, that is Bartonella lighting up in the bone matrix of the femoral head of a veterinarian who had to have a hip replacement, and they found Bartonella they actually analyzed the femoral head. So that's just one of the examples of how these One Health partnerships can be so powerful. Animals can be sentinels, as Jack alluded to in his opening comments. We all live in the same environment with our animals, many of us with our companion animals sleeping in our beds with us. And so if our pets bring in fleas or ticks, they can end up in our beds with us. But I'd like to just mention at least one other example of how animals can serve as sentinels for things that we humans are being exposed to. Back in the 80s, now I came out of vet school in 1981. I was not taught anything in vet school about hyperthyroid cats. But in the late 80s, we started diagnosing hyperthyroid cats. And it turns out somebody brilliant noticed a correlation, an association, or at least realized that it was in the 80s that we introduced, at least in the US, I'm not sure about Europe, we introduced polybrominated diphenyl ethers into the environment for flame retardants. We were even putting them in children's pajamas. So they were in the carpets and the curtains and the hard plastics of the computers, and these PBDEs were outgassing in the dust particles and getting on our cats. And of course, cats sit around grooming, and they were getting very high doses of this. And it turns out these PBDEs are powerful, powerful endocrine disruptors. So we were seeing hyperthyroid cats because of their exposure to the environment, and they were actually serving as sentinels for what we humans, especially very young humans, tiny babies, we're being exposed to. You might want to, you know, some people call them rugrats, they're crawling around the floor. But so Heather Stapleton at Duke University here in North Carolina has actually done a study looking at PBDEs in the blood of young infants and found quite a bit of it. So that has been outlawed now. We don't put PBDEs in children's pajamas anymore. It was you know, we wanted to prevent fires, but we don't want to disrupt children's endocrine systems. And it's even been hypothesized that some of the childhood obesity epidemic that we're seeing could be associated with some of the endocrine disrupting chemicals in the environment. So the same kind of story was also brought forward with perfluoroalkyl substances, the PFAS. We know now that PFAS has been put in, it's kind of like PBDEs that were put in many, many things, not only as flame retardants, but as lubricants. And they, you know, they're in the coating, the Teflon coating of many, many cooking dishes and pots and pans. So we really need to be cognizant of paying attention to the animals and the environment for what they could tell us about what we're being exposed to. And one of my colleagues, I hope some of you will take time to go and look for this on YouTube. Just search Tracy McNamara, Canaries in a Coal Mine on YouTube, because my colleague has made a really powerful story for how, at least in the US, I'm guessing this is the same way in Europe and many other countries, we're not paying attention and we're not doing biosurveillance of what may be showing up in the animal. I'm not talking so much the economic agricultural species like the cattle and the sheep and the pigs, because those are being paid attention to by USDA. But for companion animals and wildlife and animals in shelters, nobody's really paying attention. And here in the US in 2017, we actually had an outbreak in a cat shelter in New York that was an influenza, a novel influenza that was zoonotic. It jumped to the veterinarians in that shelter. And the scary thing here is that before they could put their finger on just what was going on, 300 of these cats had been adopted out to homes. So they had to go trace them all back. They had to take all the precautions. And so why am I telling you this story? Because what if that incident coming out of shelter animals in New York had been what we're seeing today? What if that was a jump of a coronavirus, or if that influenza had been as virulent or as destructive as the 1918 flu pandemic, which, by the way, my own great-grandfather died in. He was a man in his 40s and left 11 children. So what if that had been the case? And so my colleague, Tracy McNamara, is really pointing out that in our current systems, the way we're structured right now, not paying attention to the animals, that we're really using taxpayers as our sentinels. And so it's very disturbing and moving to hear her say that we really are not going to detect some of these things until we end up with bodies in the morgue. And that's kind of where we are right now in our pandemic, because we didn't really think through a lot of the things that are going on around the world and right in our, in our backyards when we're, thinking of all the wild animals that we're not doing biosurveillance and paying attention to. And that's in spite of the economic impact. And we know the economic impact is incredible. And we know there's so many publications out there about just how much money we could save if we were using this One Health approach to really approach all of our problems, and not just zoonotic diseases, but very much especially zoonotic diseases. So vector-borne diseases are absolutely right smack in the middle of the human-animal environment space of One Health, absolutely a One Health issue. And it's, as Jack mentioned, it's not just Lyme disease, it's many of the vector-borne diseases. In fact, we've known for quite some time, this paper came out back in 2003, where they actually were seeing the association between the encroachment on wild spaces and kind of fragmenting of forested spaces, and realizing that, the less biodiversity and the smaller the forest spaces, the more cases of Lyme disease and the greater number of mice. So it is what we are doing as humans that is having an impact on what we're seeing and what you guys end up having to pay attention to and do research on, and what people like Robert Mozziani and Jack end up having to treat in people. So what I'm urging you to do is I know you have to focus on your particular area, but I'm urging you to also be aware that things in a bigger picture are going on that we all need to be paying attention to together. So, you know, these diseases, as Jack pointed out, are happening in both the people and the dogs. And some of you have seen these graphs before, or these images before. This is CDC's plotting of the Lyme diseases that were diagnosed and had been plotted out that they were aware of. And these came forward in 2016. And the Companion Animal Parasite Council has done a similar, and it's a fabulous way to do this, because IDEX is one of our, for those of you who are not veterinarians, for dogs in the United States and many other places of the world, there's a little 4D SNAP test where they test for heartworm disease, but they're also testing for Ehrlichia, Anaplasma, and Lyme. Now, this is not active infection. These are antibodies that these little SNAP tests are picking up. But they've plotted this, and for that same year, you can see the overlay of the maps for exactly how the dogs were in the environment and showing what the people were exposed to. And the same thing is seen in 2018. So unfortunately, this 2018 map is the last one on the CDC website. So we don't have current maps for that. So you can't use that predictively. And I noticed that last night I went looking for some of the same kind of information and discovered that Bayer Animal Health has also been tracking Lyme borreliosis in companion animals in Europe. And this plot on the left is actually just a plot of where the Ixodes or Sinus has shown up in Europe. So, you know, this kind of information, if we would just pay attention, could really be predictive. Actually, some people are beginning to think that the canine maps for Lyme disease could be a better predictor of risk for humans than CDC. And the main reason for that is that that delay, that lag in getting the CDC maps out there. And so this is a statement that I found on a blog last night that I just think is so incredibly important, because we're recognizing that dogs really can be, in this case, the canary in the coal mine for vector-borne diseases. How come we're not getting more education out there about that? So this is where another place that I think One Health conversations and One Health education could really, really help us is our really urgent need for get the education out there about these many disease processes and what we can do and teach children how to prevent them. So if we were paying attention, because this is the map for dogs for 2020, they're plotting these IDEX antibody Lyme responses in dogs kind of in real time. If we would just be paying attention and we knew to be paying attention, then we might actually raise the warning and urge people in some of these areas to really be taking more precautions. And this is true. I mean, I'm dreaming of a day when we actually have maps for this, for things like glioblastoma multiforme, which is exactly the same in dogs and humans. In fact, we're actually using dogs now we're training them to sniff out things like ovarian cancer and coronavirus. So many of these things that the human animal, like the companion animal, the dog human interface can be very powerful. I'll just mention in passing this whole idea of what we can learn from each other, from the human world, human health world, and animal health world. And my colleague Barbara Nettison Horwicz and her partner Catherine Bowers, who wrote the book Ubiquity. If any of you haven't read that, it's a great read. It's her way of trying to help her colleagues in the human medical world realize some of the similarities and the same issues that are being dealt with in the veterinary realm. So what are our challenges? They are so many, all the way from our academic tenure process doesn't really reward cross-professional collaborations, our government agencies in silos. In the US, NIH does human health, USDA does animal health, and species that are of economic agricultural importance. It's just why we've got wildlife and companion animals left out. And industry research is proprietary, our publication systems, even though most research is funded by public dollars, it often ends up getting published in journals that are owned by associations, and only members of those associations have ready access. And simple little things like the language barrier push us into these silos. It's our systems that have pushed us into these silos, and that we all kind of collectively, now that we're recognizing this, need to be doing the things, figuring out what we can do. So this is actually, I'm just going to give you like a minute of some of the things going on in the One Health space. So much happening around the world to educate us about this One Health concept. and what we need to be doing. We started in 2016 on One Health Day. In fact, Jack or Gardana, please be sure that this conference gets registered as a celebration for One Health Day 2020. We're obviously we're not encouraging in-person meetings this year, but there's so many things that we can do and able to do to really educate the world about this One Health concept. Here in the US, we do have a One Health office at CDC. Interestingly, they're doing fabulous, fabulous work and doing some international work. But interestingly, when you really drill down on this, it's just because there are people in our agencies that understand, a few people in each of our agencies that really understand this and are really trying to help us as a society understand our need to do this. But there is absolutely there is zero line item budget items for One Health in the US federal budget. So we could go a long, long way. On the international scene, the FAO and OIE and WHO, of course, WHO for human health, FAO for food, and OIE for animal health. They have pledged a number of times to work closely together and really do try to do that. There's an International Student One Health Alliance that the One Health Commission has been very happily supporting and facilitating. Many states here in the US, I say many, 3 that I know of, have declared One Health months. So, we're starting to make some progress at getting lawmakers and policymakers to understand this. And last year here in the US, we had 2 One Health bills introduced into our Senate and our House. They're still sitting in referral committee, probably won't get passed this year unless they get folded into some larger pandemic stimulus response. But this particular these bills, the same exact bill for it's One Health for emergency preparedness, would create a One Health program across our federal agencies in the United States. And I would love to hear if things like this are actually happening in other countries from any of you. I just also really want to make you aware of this outbreak exhibit, because some of you might be interested to bring this exhibit to a library or a shopping mall or your academic institution, because there is a version that travels, and it's a very powerful version it starts you out with the 1918 flu pandemic, and you walk in and it's One World, One Health, and teaching the public, because before the pandemic, millions of people were filing through this, and it'll actually be in place in Washington, D.C. in the Museum of Natural History until November of 2021. So I know my time is up. I've got just a burning desire to tell you that I really see One Health as our ray of hope for the future, and remind you that the collaborations we need are going to start when we find ways to come together and meet each other. Just give a real quick shout out to the organizations that support the One Health Commission, and thank you very much, and invite you to dream the future with me, because if we can't envision the future and think about what it would look like and talk about it, it's never going to happen.